For nearly 60 years, Humana has been dedicated to the care of our members. Through our expertise and partnerships, we provide a range of integrated health services designed to adapt and evolve with you, wherever you are on your health journey. Choosing the right Medicare plan can help you get the care you need to feel your best. Humana can help you understand your plan choices. In many communities, Humana offers plans with extra programs and services, keeping whole person care front and center. Extra services and programs may include transportation to and from your physician's office, Silver Sneakers fitness programs, and more. According to a 2018 Humana Value Report, Humana Medicare Advantage members who see a value-based, integrated care primary care doctor who focuses on their patients' total health and well-being have approximately 15% lower medical costs than those in Original Medicare. They also had fewer emergency room visits and lower hospital admissions than those members in a standard fee-for-service doctor-patient relationship. There are specific times when you can enroll, disenroll, or change your Medicare plan. The annual enrollment period is October 15th through December 7th. During the rest of the year, if certain conditions apply, you may qualify for a special enrollment period. Ask your licensed sales agent if you qualify. Now think about your Medicare options. Option 1 is Original Medicare Part A and Part B through the Centers for Medicare and Medicaid Services. Parts A and B help cover many hospital and doctor costs, but not prescription drugs, so you may need a separate Medicare Part D prescription drug plan. If you do not select a Part D prescription drug plan when you're first eligible, you may be subject to late enrollment premium penalties when you do enroll that will be in place for the duration of your prescription plan enrollment. Option 2 is Original Medicare, plus a Medicare Supplement Insurance Plan, plus a prescription drug plan. A Medicare Supplement Insurance Plan, or Medigap policy, helps lower costs by paying deductibles and coinsurance Original Medicare doesn't cover. But these plans don't cover prescriptions. You'll need a separate prescription drug plan for that. Option 3 is a Medicare Advantage Health Plan, also called Medicare Part C. Many Medicare Advantage plans also offer drug coverage, so you wouldn't need other prescription coverage. You can get a Medicare Advantage plan with prescription drug coverage, an MAPD, through private companies like Humana. Many Humana Medicare Advantage plans also include virtual telehealth visits for care when you can't see your regular doctor. This service may let you speak with a medical or behavioral healthcare provider over your computer, tablet, or telephone. Another resource is Humana's Care Highlight program, with healthcare provider scoring to help in choosing doctors. You can reach it through findadoctor@humana.com. With or without prescription drug coverage, Medicare Advantage plans have all the benefits of Original Medicare and may have lower out-of-pocket costs. Most Medicare Advantage plans also offer extra benefits. With Medicare Advantage, you still have Medicare and must continue to pay your Part B premium, but you have the version managed by a Medicare Advantage company like Humana, rather than by the federal government. Now that you know your Medicare choices, how do you choose your plan? Ask yourself a few questions. What type of plan do you have now? What do you like about your coverage? What would you add to make it even better? Is someone helping you make healthcare decisions? With the answers, you're ready to look at plans. Let's look at a Preferred Provider Organization, or PPO. With a PPO plan, you have a network of doctors, specialists, hospitals, and other providers. You can also choose to see out-of-network providers who are eligible to participate in Medicare and without a referral. But unless you need emergency or urgent care, choosing an out-of-network provider may cost you more. Staying within your Preferred Provider Organization's network may keep your out-of-pocket costs lower because the plan typically pays a larger share of the cost. Here's a fact that may be important in your planning. The Centers for Medicare and Medicaid Services prohibits combining a standalone prescription drug plan and a Medicare Advantage PPO, even if the PPO doesn't include prescription drug coverage. Ask your sales agent to review your options with you and to review any prescription drug coverage and specific medicines it covers. Humana's drug list is also available at humana.com. Even if your medicines are listed, Humana may require you to try certain drugs first to treat your health problem before we'll cover more expensive drugs. This is called step therapy. Not all brand name drugs may be covered since manufacturers must agree with CMS's terms and conditions to contract with Medicare. In the coverage gap, or donut hole, you pay part of your drug cost before additional Medicare coverage kicks in. In 2020, you'll pay no more than 25% of the cost of many generics, and no more than 25% of the cost of many brand name drugs during the coverage gap. If you have both Medicare and Medicaid, you may be eligible for another type of Medicare Advantage plan with prescription drug coverage. Ask your sales agent if a dual-eligible special needs plan, or DSNP, is a good choice for you. Now that we've talked about when to sign up, your Medicare options, PPO plan specifics, and prescription drug coverage, what's next? Your sales agent will go over 3 important documents. One is the Summary of Benefits, which covers many of the features of the PPO health plan. Next is the plan's star rating, and the other is the plan's drug list. If you sign up for a PPO, we'll send your ID card in the mail. You can choose to receive certain plan documents online instead of mailed to your home. If you go digital, we'll email you a link to activate My Humana, your secure online account. Go to My Humana anytime to get started, learn more about your plan, and see your documents. By providing your email address, you authorize Humana to send you health information at that address. So if your email changes, be sure to let Humana know. You'll also complete a health assessment to see if you qualify for any special health programs. And be sure to attend a member orientation. We've covered a lot of information today, but if you have questions, call 1-800-457-4708, Monday through Friday, 8 a.m. through 8 p.m. We're committed to your healthcare and always happy to speak with you. Your licensed Humana sales agent, who presented your specific plan benefits today, can answer any of your questions. Another great resource is the Medicare and You Handbook you should have received in the mail. You can also go to www.medicare.gov. Thank you for your time and interest today.